Chapter 2, Shoulder, Calcific Tendinitis Treatment and Follow-Up. Conflicts of interest. I'm a stockholder with Sonics Health and co-editor of a textbook on musculoskeletal ultrasound. This patient was picked as an example because she had a particularly large deposit of calcium in front of the subscapularis insertion and lesser tuberosity. As we look at her, this calcium is on the right and the coracoid is on the left, and she's actually impinging. At this point, she was sore, but not quite as sore as she had been 2 days before when she called to make the appointment. Here we're injecting some lidocaine into skin, muscle, and mostly into the bursa. If you complete this injection, things will be numb except for bone. Here's some more injection of the bursa. And this gives a quite nice anesthetic. Then we start with the calcium. The softer calcium you can see through, and so it's likely to be smaller fragments or maybe even sort of a toothpaste consistency. Here's an 18 gauge needle going into the calcium that we can see through. That is, we can see bone deep to the calcium. And we can inject lidocaine or saline and aspirate, and sometimes it's necessary to put a second needle so that the clear fluid flows in one needle and the calcium-containing fluid goes out the other needle. Here's some more washout of the calcium, and you can see that it becomes more transparent the more calcium we remove. Here we're running up and down the arm in the short axis. You can see that we started with hard calcium and then we get into the softer calcium. And this is what the aspiration looks like. This is actually quite a large amount of calcium there at the lower part of the syringe. Now we'll move to the calcium that appears to be solid. That is, we can't see through it with the ultrasound. And again, we're using an 18 gauge needle and a fluid like lidocaine or saline to pump it in and out of the calcium and aspirate it. And again, this may require a 2-needle technique. And here we can see the calcium becomes more transparent as we remove some of it. An alternative method is the 10X. This is a different patient, and her calcium was made up entirely of hard calcium. And what the 10X does is it uses a system similar to phacoemulsification to break up the calcium so that it can be sucked out. 1 month after her treatment, she feels much better, but you can see that there is still some residual calcium within the tendon, and there is still some inflammation where the calcium is being absorbed. In summary, I think also ultrasound is an essential tool for assessing and for treating calcific tendinitis. Thank you for your attention. For other additional cases, please see our textbook, which is available at Amazon